The world today is witnessing a revolution in longevity. Thanks to scientific advancements, more people are living past 70, 80, even reaching a century. Yet the question remains, how can we transform these extra years into true health span, where independence, vitality, and cognitive sharpness are preserved? Allow me to introduce myself, Dr. Lauren Pierce, a board-certified geriatrician with over 20 years of practice across European medical centers. I have devoted my life to studying the physiological and psychological transformations of the older adult and to helping my patients age not just longer, but better. Let's begin with the real struggles many face. Imagine waking up at 72 and feeling the weight of solitude, the stiffness in your joints, the suspicion that society expects you to fade quietly into the background. This is the story of Paul, a retired engineer from Denmark. After decades of building bridges, his world shrank overnight following retirement and the loss of his wife. He began to neglect exercise, assuming, at my age, it won't make a difference. His muscle mass dwindled, frailty crept in, and occasional forgetfulness started to worry him. Paul's experience isn't unique. Epidemiological studies show nearly 40% of Europeans over 65 fail to meet basic physical activity recommendations, and many underestimate the impact inactivity has on health trajectories. Now, here's the paradigm shift I bring to every patient and audience, including Paul. Musculoskeletal decline, cognitive changes, and cardiovascular risk, these are not inevitable. Interventions, even initiated late in life, can dramatically alter functional status and future quality of life. Let us unfold the comprehensive approach that I, Dr. Lauren Pierce, utilize and recommend. The fundamentals of healthy aging physical activity, the multimodal solution. Numerous cohort studies across Europe have established the critical role of regular structured exercise. But this isn't about marathon running or unsafe exertion. Evidence strongly supports multimodal regimens, those pairing resistance training, like weight-bearing or bodyweight exercises, with aerobic activity, walking, cycling, swimming, and integrating balance and flexibility work. At AgeWell Europe, a controlled trial demonstrated that bi-weekly 40-minute sessions combining resistance bands, dance-based aerobics, Tai Chi balance drills, and yoga stretches led to measurable improvements in muscle strength, bone mineral density, proprioception, and gait stability among participants aged 70-88. Let us look at the outcomes. After 12 weeks, average scores in the short physical performance battery improved by 18%. Incidence of falls and hospitalizations dropped more than 35% over the subsequent year for those who continued regular classes. But it's not only the body that benefits. Structured, interactive exercise triggers neurotrophic factors, BDNF and IGF-1, vital for synaptic plasticity and memory retention. Maria, a former teacher from Florence, exemplifies this power. At 75, she joined a local senior movement program I helped design. Within months, her gait speed and grip strength improved, her depressive symptoms lessened, and she reported newfound energy for daily social activities. Nutrition, evidence-based dietary strategies. No discussion of healthy aging is complete without addressing nutrition. Decades of prospective research point to the protective effects of the Mediterranean diet and the Alternative Healthy Eating Index, AHEI. Let's dig into the components. Emphasize a high intake of fruits, vegetables, whole grains, nuts, legumes, and unsaturated fats. Olive oil, rapeseed oil, moderate consumption of lean proteins, especially fish and low-fat dairy. Limit red meat, processed foods, refined carbohydrates, and sodium. Ensure adequate vitamin D, vitamin B12, calcium, and omega-3 fatty acids. Clinical trials have proven that older adults adhering to these dietary patterns maintain superior cognitive function, lower rates of hypertension and type 2 diabetes, and slower rates of sarcopenia. A longitudinal study published in Nature Medicine tracked over 100,000 participants and found that individuals in the top quintile for diet quality per AHEI were 2.24 times more likely to reach age 75 free from chronic disease, cognitive impairment, and disability. Medical interventions and preventive care. But healthy aging isn't only about lifestyle. It involves vigilant medical care. Routine health assessments should always include comprehensive geriatric screening for frailty, depression, fall risk, cognitive evaluation using standardized tools, e.g., MOCA, MMSE, regular monitoring for cardiovascular risk factors, blood pressure, lipid panels, glucose, bone density scanning for osteoporosis management, advanced immunization schedules, influenza, pneumococcus, herpes zoster, cancer screening as appropriate, breast, colon, and prostate. Innovations in e-health, the integration of wearable devices, telemedicine, and online cognitive training, are revolutionizing elder care. These platforms enable remote monitoring of cardiometabolic parameters, medication adherence, and prompt intervention for acute health issues. Dentistry is often overlooked but crucial. Maintaining optimal oral health by regular dental checkups and prosthetic management not only preserves nutritional status, but also reduces inflammation and systemic disease burden. Social engagement and psychological wellness. Numerous studies identify social isolation and loneliness as independent risk factors for mortality and cognitive decline. I routinely encourage my patients to join community activity groups, volunteer organizations, or regular family gatherings. Group cognitive stimulation, book clubs, language classes, music groups, enhances neurogenesis and maintains mental acuity. Sleep. Optimizing quantity and quality. Sleep disorders are prevalent in geriatrics and contribute to functional decline, accidents, and cognitive loss. Optimal sleep hygiene, consistent routines, limiting stimulants, alcohol in the evening, exposure to natural daylight, and potential use of melatonin under supervision is a mainstay. The target is 7 hours of restorative sleep nightly for most adults, 65 and above. Pharmacological management medication review is paramount at every visit. Polypharmacy increases adverse event risk. Deprescribing unnecessary agents, optimizing for the smallest effective doses, and using medications with geriatric safety data are essential practices. Specific interventions. Bisphosphonates or denosumab for osteoporosis prevention in high-risk cases, use of selective serotonin reuptake inhibitors, SSRIs, for late-life depression, judicious antihypertensive and statin selection tailored by clinical frailty scales, technological advancements. Digital health solutions have greatly expanded the toolkit. Remote patient monitoring, wearable emergency fall detection, and cognitive training apps such as MindMaze and BrainHQ are incorporated into personalized geriatric management plans. The superager concept. A remarkable subset, known clinically as superagers, retain superior executive function, memory, and motor skills as they enter their 8th, 9th, or even 10th decade. Research led by teams at the University of Cambridge and the Karolinska Institute has identified several shared traits among European superagers. Consistent lifelong physical activity, robust social networks, flexible cognitive habits, ongoing learning, multilingualism, artistic pursuits, emotional resilience and proactive health management, therapeutic innovation, and future prospects. Ongoing clinical trials in geriatrics are testing regenerative techniques, muscle stem cell transplantation, anti-inflammatory biologics, and senolytic agents. Neurostimulation and targeted nutritional supplementation, e.g., NAD+ boosters, omega-3 concentrates, are being studied for their potential to preserve neuroplasticity and delay frailty syndromes. Case integration. The advanced care pathway. Let me return to Paul, our Danish engineer. Through a dedicated multidisciplinary approach, physical therapy, evidence-based dietary reevaluation, medication optimization for hypertension and osteoarthritis, structured telehealth check-ins, and weekly social group engagement, Paul reclaimed his independence. After 18 months under my care, he returned to cycling, rejoined his bridge club, and even enrolled in a university course on architectural history. Conclusion and call to action. Aging is both a personal journey and a societal challenge. The science is unequivocal. With expert-guided interventions, it is possible to maximize years of vitality, purpose, and connection. Every moment presents an opportunity to initiate change. Whether 70 or 90, the evidence supports transformation is always possible with the right steps. Today, Dr. Lauren Pierce invites you, whether you are a clinician, a family member, or an older adult ready to rewrite your own story. Begin now. Move your body, eat for function and pleasure. Embrace social connection. Seek medical support proactively. Innovate with technology. Embrace curiosity, resilience, and adaptability. To all medical professionals, prioritize preventive geriatrics. To every individual, do not accept decline as a destiny. You possess the power, backed by science, to become your own super-ager. Let's make longevity not just a number, but a profoundly healthy, joyful, and meaningful season of life across every corner of Europe and beyond. If you found value in these insights, subscribe to our channel for continuous updates, share your own journey, and inspire others to pursue excellence in aging. With guidance, compassion, and unwavering scientific rigor from Dr. Lauren Pierce and the European medical community.